Hello, everyone, and welcome to our Understanding Ableism webinar series hosted by the King County Disability Consortium and the Disability Empowerment Center. My name is Sarah Marshall, my pronouns are she, her, and I am an AmeriCorps member serving at the Disability Empowerment Center as the King County Disability Consortium coordinator. I am a young white woman in my 20s. I have short brown hair with bangs. I'm wearing a pair of gray headphones and a striped button-up top today. So before we get started, I'll quickly go over some housekeeping and accessibility information. To anyone who needs them, captions are available. You can navigate to the bottom of your menu tab, click the Show Captions button, and they should turn on. We have a manual captioner with us today, and the captions will also be running at captionviewer.net. If I could ask our manual captioner to paste URL in the chat, that would be lovely for anyone who needs it. We also have ASL interpreters available today. Interpreters should always be visible, but please let us know if you're not able to see them for any reason, and make sure that you're not pinning them as they switch, because as the presentation goes on, the interpreters will change. So if you actively pin one, they might disappear after they turn their video off, excuse me. The event is being recorded, so for anyone who maybe has to leave early or would like to share it with anyone else, it'll be posted to the Disability Empowerment YouTube channel. And then finally, we will use both person with disability and disabled person interchangeably, recognizing that different people have different preferences for person first or identity first language. And then one final thing, I realized I forgot to tell our panelists this, but as you're answering questions, just make sure that you turn your camera and microphone on, and then when you're done answering your questions, you turn them off. And that way it just makes sure that whoever's speaking will be featured for all our audience. So I like to start each of the webinars with a definition from disability researcher Ian Langtree, who defines ableism as a complex system of beliefs, practices, and institutional structures that position disability as inherently negative while simultaneously privileging non-disabled bodies and minds as the standard against which all others are measured. And so with this definition in mind, the Understanding Ableism series was created to explore how ableism shows up in our policies, communities, and everyday interactions. Each session brings together community members and advocates to share lived experiences and practical knowledge with the hope of helping us all move towards a more inclusive and accessible King County. And then for a little bit of background for the King County Disability Consortium, it began during the COVID-19 pandemic as a way to connect disability-serving organizations and community members during a time of widespread isolation and uncertainty. Many people with disabilities face disproportionate barriers, from healthcare access to transportation, digital communication, and basic safety to many more. So KCDC was built to share information and elevate lived experience to respond to the needs of our disability community. So for this month's topic, we will explore how disability shapes experiences in outdoor and recreational spaces, and how ideas about access, inclusion, and belonging influence who is able to participate in nature and outdoor activities. While the outdoors are often perceived as open and accessible to everyone, disabled individuals frequently encounter physical, social, and environmental barriers that can limit participation. Throughout this discussion, our panelists will examine the ways accessibility is experienced in outdoor settings, reflect on the role of community and representation, and consider how outdoor spaces can become more welcoming and inclusive for people with a wide range of disabilities. So I'm going to have our lovely panelists introduce themselves, and we'll go in order of who is listed on the PowerPoint, which will be Paris and then Molly.
Hello, I am Paris Van Quill. I use she, her pronouns. I am a young white woman in my 20s with long brown hair, bangs, glasses, and an emerald green t-shirt on today. I am the recreation coordinator for specialized recreation within Auburn Parks and Rec. We build indoor and outdoor recreational opportunities for people with disabilities, including but not limited to fitness and athletics, socials, crafts, field trips, and life skills programs. I have been part of or working within the disability community since 2020 and with Parks and Recreation since 2022. One of my favorite things is sharing my love of the outdoors with pretty much anyone who will indulge me. And this isn't just for my job. I've spent my whole life supporting people I love in the disability community. You'll notice my brother's here on the panel. I want to center the voice of the disability community in my work, and I will pass it off to him at some point during this speech or talk or webinar to have him share his perspective.
Good morning. My name is Molly, and I am a white, middle-aged 57-year-old with blondish gray hair, wearing glasses and a white shirt. I am a program coordinator manager for STIX Diabetes Programs in Spokane, Washington. We run diabetic camps for kids over the summer and provide community outreach all year round for families with kids that have type 1 diabetes. And you might notice that I share the same last name with the moderator, who is actually my daughter. So I am also a parent of a type 1 diabetic.
Okay, sorry everyone, my computer is running a little bit slow today. Hopefully you all can still see and hear me. This is Sarah speaking again. So we're going to move on to our first question, which is, what does access to the outdoors mean to you, and how has your perspective been shaped by your work or lived experience? And so again, we'll start with Paris.
This is Paris speaking. For me, access to the outdoors isn't a nice to have. It's a vital part of being human. Time outside is tied to better mental health outcomes, higher confidence, and a better quality of overall life. It shows up in so many ways: hiking, biking, walking, boating, just sitting in nature, going on a walk, or getting into athletic programs, whether they be intramural, competitive. Uh, no matter what recreation looks like, there's friendship and community that can be found through shared outdoor experiences. Folks with disabilities are more likely to experience mental distress, depression, and isolation. So reducing barriers to the outdoors and creating accessible opportunities for engagement isn't optional. It's paramount to the health and well-being of the disability community. For me personally, I grew up playing competitive sports and continue to do so in my personal life and through work where within Auburn Parks and Recreation Specialized Recreation, I coach athletes in dozens of seasonal sports, including bocce ball, basketball, soccer, baseball. There's too many to name, but every sport you can think of, practically, we do it. I love to hike, kayak, nature bathe, go to local parks, interact with trees that are older than me, older than this country, and watching wildlife, and taking people out to experience that with me. I actually asked my brother to speak on this too. He is a person with a disability. We're close in age, and I think through our lived experiences, there's a significant contrast in how much access we've had to the outdoors, which is why this conversation matters to me and what got me interested in working with the disability community. So I'll pass it off to Jackson.
Hello, my name is Jackson Van Quill. I am Paris's slightly older brother. I have short black hair and tan skin. and I am making him. I was asked to kind of be a guest today to give my firsthand experiences as a disabled person. And to me, uh, being outside, being outdoors, it means a lot about inclusion and making friends and memories without feeling like you have to be worried about how your disabilities limit you. Over the years, me and my friends have gone on numerous different adventures like hike, bike, and sails in the San Juan Islands and water rafting in Oregon. Uh, and they've always done such a good job of making me feel included and helping me anytime I need it. But the biggest thing, honestly, is just the encouragement and the support that people give me. They never automatically assume I can't do something or, make me feel like I'm different. They're always encouraging me and trying to get me to do things. It was similar. I played sports for a few years growing up. I played soccer. Uh, and that was similar. Everybody was very encouraging and very helpful, very supportive. I actually had to quit when I was about 8 or 9 due to my disabilities and the fact that people even younger than me were getting bigger and more skilled and more advanced than I was. Uh, and it didn't really bother me a whole lot growing up, but as I look back on it, I realized I missed out on a lot of interactions and uh, just that team camaraderie aspect of life. But I love being outside. I like being outside more than inside. It's just all about finding, what works for you and how you can really enjoy it. Thank you for letting me be on the panel today.
This is Molly speaking, and outdoors has been a big part of our life, our family's life. I'm going to speak to our family because I think it's important, but I do, echo what has been said, that it is such an important factor for our mental health, our physical health, our spiritual health, and just health in general. So as a family, we were very, very active in the outdoors. And once our daughter was diagnosed with diabetes, we had to make some accommodations. And it took many years for us to be able to prepare and be successful in supporting our daughter as we did these activities. We did not decrease these activities. We just learned what we needed to do to make sure she was safe. So as that will parallel into now our STIX Diabetes programs with our camps. So one of the most important things we provide is an environment that allows parents the confidence to know that they can leave their children with us in a safe environment, where they will be supported with their diabetic care. And we do that by providing hundreds of volunteers. And I am not joking, over 100 volunteers at our camps that come, trained adults, medical, nutrition, mental health, trained, and who understand diabetic care and can provide that service for these kiddos. We also provide an environment where we have all the supplies they need, the backup medical supplies, emergency supplies, just basic snacks to help with their blood sugars. And I think, one of the most important things, like I said before, is providing the safe environment for these kiddos and their families. What it does for the kids at camp is allows them to try things maybe they wouldn't have tried before, but in a supportive, inclusive environment. It's just a really incredible experience to see how just maybe 1 week of camp in a supported environment allows these children to grow in a way that that there's just no way to replicate that in our day-to-day lives. It's a pretty powerful experience, and I'm really so thankful to be a part of that. I think my life as a mother of a type 1 diabetic has actually prepared me for this role now, which is, not a job. It is a passion and a joy. And I'm very thankful to be part of this community.
Thank you so much to all our panelists for your responses. I think you all speak to a breadth of the disabled experience, whether as a caregiver, as a family member, or as someone who's personally experienced things. So we're going to move on to our next question, which is, what are some barriers or unexpected challenges that disabled people may encounter while spending time outdoors?
Hi, Paris speaking. I had to condense my answer greatly for this question. I feel as if the list goes on and on for this. In my experience personally, working in a Parks and Rec department, I've noticed that a lot of people just don't know if the door is open and where to find it. Opportunity is the biggest limiting factor, and that's partly historical. Outdoor recreation wasn't built with this community in mind, and so over time, nonprofits and government and policy like the Americans with Disability Acts have came and intervened and carved out space, but that is retroactive. It wasn't founded with this community in mind. So there's no existing template that families can just assume exists. A lot of individuals don't know which organizations and programs exist around them. And ironically, there's a lot of duplicate services in the communities. Funding, missions, and referral process can scatter. And so it takes a lot of time and energy to figure out what's right for you, where it is, and how to get started with it. And in the disability community, people, individuals, families are already carrying a full plate. Outdoor recreation is competing with day-to-day life, medical appointments, IEPs, insurance paperwork, everything that comes along with living as a person with a disability. In addition to those structural issues, sometimes parents and caregivers, coaches, and even participants themselves can carry assumptions about what's possible. Physical health literacy is really important within this community. Kids and adults with disabilities need real, repeated chances to learn how their body moves, what feels good, what they enjoy, and also given space to explore that and experience that in a safe environment.
Hi, this is Molly speaking. So barriers to the outdoors. Well, the outdoors is just inherently unpredictable. So for a type 1 diabetic, things that affect their blood sugar include physical activity, temperature, the altitude, hydration, stress, the timing of their meals. So being able to plan for that is key. Some other barriers are logistical. For insulin, that is something that needs to be kept refrigerated or cool. So safe storing of insulin is definitely a barrier. Technology is a great thing. However, it is also a burden. So a person with type 1 usually has an insulin pump, which needs to be charged. Possibly a blood glucose monitor, which gives real-time blood sugar, which then needs possibly Wi-Fi to connect to their pump to report their blood sugars. All these things need to be charged. So deciding if you're going to live in this new technological environment, as opposed to maybe going manual with shots, is a pretty significant barrier. And understanding if you're going to participate, are you going to have these things accessible? And then, a big thing is access to emergency supplies. Medical supplies are often, insurance companies will only allow you so much of a medical supply. So if you're planning a long trip and you need extra supplies, it could be a real challenge to get those from your insurance or just paying out of pocket. Along the same lines, social barriers. Diabetes is an invisible disease. And so people might not understand, if you're out recreating, why someone might need to take a break, maybe have a snack, or check their blood sugar. So I think that the key to all of this is just making these accommodations, understanding and normalizing, especially diabetic care. These things can make a huge difference.
Thank you for your thoughts. I think you both brought up some really great points about kind of the breadth of challenges that disabled people face when it comes to the outdoors. And I think as well as how individualized some of those challenges are. We often throw out, disability as an umbrella term, but people's conditions and their access needs vary greatly. And so it's sometimes very hard to think about policies or programs that really can kind of encapsulate the entirety of the disability experience, because oftentimes they can't. So we'll move on to our next question here, which is, when people think about the outdoors is in quotes, they often picture a very specific type of recreation. How can we broaden our understanding of what outdoor recreation looks like? We'll start with Paris.
Hi, Paris speaking again. Outdoor recreation is constantly evolving. It doesn't look like just one thing anymore. The way we engage in athletics is different than 20, 30, 40 plus years ago. Locally, we've got municipal parks and recreation programs, nonprofits like Outdoors for All, vendors like Sail Sand Point, who does adaptive sailing up out of Magnuson Park in Seattle, all pushing on different fronts to make outdoor recreation more accessible to the disability community, which includes physical or considerations for physical, cognitive, intellectual, and beyond. Nationally, there are groups like Move United and Project Play that are building frameworks and funding to allow organizations like the ones mentioned on a local level to expand inclusive and specialized recreation. At Auburn Parks specifically, we're designing our regular programming to be inclusive and hit the marks of inclusivity, on top of having dedicated specialized recreation, which I oversee. Inclusive programming means people with and without disabilities can do the same activity together, whether that means certain participants need adaptive equipment or a one-on-one support. But accommodation is essentially built into the design. And then our specialized programs, on the other hand, center the disability community entirely, and offer a comfortable space where we can exist in outdoor recreation.
Hi, this is Molly speaking. So I love to think about the outdoors as what brings me enjoyment. And I think if we think outside the box, just even spending time outside is pretty impactful. At camp, we offer a lot of different things, just taking walks in nature, doing games and things like that. I think one of our most impactful things we do at camp is on the last night, we all sit around a campfire and in the dark with the campfire glowing, and each camper gets the opportunity. They take a stick. We are called Camp Sticks. So we have a stick and they stand up and they say something impactful about maybe how camp had changed them, or maybe it's a worry about going back. Maybe they're concerned about a family member, but they put that intention in the campfire and everyone listens respectfully. And it is a powerful experience just being outside with that campfire. So I think there's, I guess just thinking outside the box, what does bring you enjoyment? For camp, we don't measure, the level of activity or any kind of competition. We actually really measure things by making sure that our campers feel included and that they are appropriately challenged. Every camper is different. They respond to blood sugars and food and activity differently. So appropriately challenging these kids, but the most important thing is having fun. The goal really here is not like an identical experience. It's just creating that meaningful opportunity for each and every camper.
I really appreciated your points about how outdoor recreation doesn't look like just one thing. I think that's something so important, especially considering sometimes I think the place where we live, Seattle, is a very urban environment, and people don't always think of the outdoors as being even located in a city, but sometimes it just means being able to go outside on a walk in a park that has a sidewalk that is accessible for mobility devices, or it's being able to walk along the waterfront, being able to have access to places without those barriers, whether that's medical or infrastructure or whatever. So very, very important points. So we'll move on to our final question, which is, what role do organizations, communities, or peers play in helping people feel confident exploring the outdoors?
This is Paris speaking. Organizations is so broad. I think as a whole, organizations should be paving the way. You have organizations that will offer the financial support and funding to make programs to get people outside work. You have the investment in adaptive equipment. You have creating the programs, referring people to services, and being aware of what's in the community. But for Auburn Parks and Recreation specifically, what we do is we carve out the space and offer the opportunity. And we work with community resource navigators to get on their radar and have them refer people over to us, so that they know that we're out here as a resource. We are here to organize support staff and volunteers so nobody's figuring out alone, help people navigate what's actually possible in an outdoor recreational setting, supportive group experiences. We create those, offer community gatherings, places where people can get outside and connect with each other. Our job is to be ready to be open for you to show up, and so we can help you explore different sports, activities, and ways of connecting with nature and people. And I think Jack spoke really well to what peers do is they carry it forward. Once the opportunity is found, peers can be a huge motivator. They offer connection and a reason to continue coming back. Oftentimes they support programs as volunteers. They can model what's possible for someone who hasn't tried it yet and help them get comfortable going out of their comfort zone and pushing their boundaries in safe and healthy ways. And a lot of times they're the ones who end up advocating for the program and policy changes that make the next person's path a little bit easier.
Hi, this is Molly speaking. I am just so thankful to be part of an organization and a community that is really helping the diabetics in our region. Um, we provide that safe space that kids can come to camp, which actually translates into parents having a week of respite for a 24/7, disability that requires a lot of effort. Um, One of the most important things that comes out of camp is allowing these kids to see other kids that have type 1, um, sharing that same similar experience and understanding they are not alone. One of the most important roles I have in this organization is then connecting to community. So we have a very wonderful program that actually reaches out to newly diagnosed families. We like to make them aware there is a community available that provides resources, companionship, and support in a very chaotic time after newly diagnosis. So we've definitely prided ourselves on having this very close-knit type 1 community. But what we found is even, I won't say more important, but as important is to connect with our community as a whole, making people aware that there is a diabetic camp for kids, that there are hundreds of volunteers in our community that participate and volunteer every year, that we provide outreach throughout the year. So we've worked on expanding our community to our, Spokane community, and actually it's a regional thing. We support the entire eastern Washington half of our state, North Idaho, western Montana, and northern Oregon. And there are 2 other camps, one down in Boise and also in Seattle. The Seattle has, great resources. They're able to have multiple camps throughout the year. So allowing our, actually informing our community of this is such a wonderful thing to get people connected. And then we were able to expand our volunteer pool, and get people involved in fundraising, and just participating. I think all that brings just greater understanding and really helps normalize diabetes as an invisible disability.
Thank you so much to our panelists for their thoughtful reflections. So at this point, I think we are going to transition to our Q&A portion. So now I'm going to invite our audience members to submit any questions they might have for our panelists using the Zoom Q&A feature. For those who are unfamiliar with this, you can find the QA tab, the Q&A tab at the bottom of your screen. It should be in a little box with I think it's a question mark, or maybe it's the words Q&A. But it should be right on the menu bar below. So you can click that, type your question, press send, and then the questions will be visible to everyone on the webinar. I will read the questions out loud to our panelists, and all our panelists are welcome to respond to any question, and you do not need to answer in the same order as earlier. It's just, feel free to jump in whenever. We'll take as many questions as time allows. And since I think we're running a little bit early, we might not go all the way to 12, so we'll just take as many questions. To get us started, I will address a question to our panelists, which is, how can people without disabilities be better allies in making outdoor spaces more inclusive? And I will put that in the chat as well.
Hi, this is Molly speaking to that. I think, it's about education and then getting involved, understanding different disabilities. So when you're in your just normal working day or living day, you're recognizing what these barriers are. And, you know, so many times I have just been blown away by the connections that I've made in the past that have come and created opportunity to make things better for people with disabilities. So, for instance, at this camp that we had just last week, we just had camp. The capacity was an issue. We needed this camp. We rent the camp, so we needed this camp to build more capacity for beds and for like showers and toilets. And so over the winter, they started construction and they put in more beds. They built a whole platform and put up yurts, little kind of tents that are just actually really wonderful. They built a whole nother like shower bathroom facility, but in doing so, they also made it ADA. So they put a ramp, they made the showers and bathrooms accessible, and then that actually then goes out to the open area for camp. So it actually opened the door for folks that might have a mobility disability.
Hi, this is Paris. I think to start off, it's really important that people without disabilities interacting with the disability community let go of fear of being the perfect ally and just come into the space open to learn and adapt. The first time I worked with a group of visually impaired individuals, I had no idea how to support them. But because I came in with an open mind, I was able to follow their lead and let them show me how to best support them. And now I have a good understanding of the standards of helping someone with a visual impairment approach recreation, or even just supporting them in getting to the bathroom or filling up their water bottle. So I think it's important to center the voices and experiences of individuals with disabilities, inviting them to take up space and not assuming their limits and boundaries, and approaching each person with curiosity and openness. Maybe you had some experience with a certain disability. It's not the same for everyone with that disability. So that curiosity, openness, and willingness to learn is just absolutely vital in supporting individuals with disabilities.
Hello, this is Jackson again. I just would reiterate both of those points that being aware and open of people that are different is like paramount. The number of people I come across, even today as a 26-year-old, that see me and don't really know what to do with me is crazy to me. You know, like disabled people are different, but they're also not. Like they're people. So you know, you treat them with kindness, you treat them with respect, and you know, you help them however you can, but you don't make them feel special or different. Uh, I think that's a big key. Openness and awareness.
Thank you all for your responses. So we have some Q&A questions, and I think we'll start with Philip, who asked, as someone who benefited from therapeutic time on the Puget Sound, do you foresee some on-water activities on a seasonal basis? And I think this might be a good question for Paris.
Absolutely. This is Paris speaking. Through Auburn Parks and Rec, absolutely. I just started this role in the spring, and I was taking over when there wasn't someone previously in the role. So right now, our summer programming is pretty bare bones, but in the future, I anticipate having quite a bit of on-the-water activities. I know several cities in the area and counties, Pierce County, Federal Way, Kent, Seattle, all have adaptive, inclusive, and specialized recreation programs. I'm not sure if they get out on the water regularly, but it would definitely be worth checking out. I also recommend, I mentioned Sail Sand Point. They operate out of Magnuson Park in Seattle, and they have adaptive and inclusive sailing just included in their programming. They're pretty incredible. And also Outdoors for All does kayaking and paddleboarding at an adaptive level. And they're trying to expand into new areas. They just opened up a new adaptive bike program in Gig Harbor. So I could totally foresee us having seasonal on the water activities available.
Okay, it looks like we have another question from Carrie Lynn Sanchez. Paris mentioned awareness of programming as being a barrier. Are there any thoughts on how we can bring more awareness to a wider audience?
I addressed this. Oh, hi, Paris speaking again. I addressed this a little bit in one of the earlier questions where I mentioned that our community resources from government to nonprofit and whatever else, there's definitely a disconnect and it's a little disjointed. And I've noticed in my work as I'm looking for community resource navigators to connect with and send our resources to, there's just you have to dig through so much and it's so hard to find me as a professional exactly what I'm looking for and exactly who I can connect with to make sure people know my programs are out there. So we do internal advertising, we try to do external and connect with community organizations. So I think you just need enough people and enough organizations to realize that there's that deficit and work to bridge the gap, which I'm trying to do within Auburn. And I know there's a lot of amazing professionals in this space who are also trying to do. So I hope this evolves and eventually there's a more streamlined community oriented way for people to figure out the type of services that are out there.
Okay, I will move on to our next Q&A question. So this is from Linda Eastlick, who says, I have a family member who has become a partial quad, I assume that's quadriplegic, identifying outdoor spaces in the Bellingham area that are truly accessible, parentheses, have usable paths, accessible bathrooms, shady spots, picnic tables, and parentheses, is challenging. Any suggestions? We've tried contacting the parks department, and they have not known whether specific parks are accessible.
Paris again. I can answer that. I will say I've been in a couple spaces and webinars with folks from up north of Seattle, Bellingham area, looking for the type of resources that are in the Puget Sound area. And I don't know if there's an amazing answer for that. If your municipal parks and rec department isn't able to point you, I know our state and federal parks and recreation departments generally have more accessibility information available on their websites. I think I wrote it down specifically. The state parks, Washington State Parks, has an interactive map that you can use to go through Washington State Park systems and identify ADA accessible parks and parks with ADA accessible features. There are also passes. On the federal level, there's a disability access pass that provides you lifetime free access to over 2,000 federal national park sites. And we have one at the state level as well. I think it's renewable on a 5-year basis, but also free. There are resources out there to help you get into state and national parks. They also offer discounts for oftentimes nature leaders and boat launches and whatever services specific parks offer. There are discounts available in association with the state and federal level passes.
One more organization I would love to quickly highlight is Disabled Hikers. They are based kind of in Western Washington, and they are extremely prevalent in the community. They also, their founder, Seren, I am not sure how her name is pronounced, but she has actually published a hiking guide and has rated a bunch of outdoor parks and forests and trails based on their accessibility. And I've seen it down in the National Park store that is in Pioneer Square, but I'm sure it is available online as well. So I believe it's the Disabled Guide to Hiking in Washington. So highly recommend that as a resource. Oh,
Sorry,
yes,
1 second.
Paris.
Can I add on to that? I just remembered the Washington Trails Association also has a list of, while not considered necessarily ADA accessible, since parks and well, state and federal parks don't necessarily have to comply with ADA guidelines. They have a list of generally accessible via wheelchair and mobility aid trails, and that's on Washington Trails Association.
Yes. Oh my gosh, another great resource. Perfect. So for our next question, do you have any recommendations for someone with a disability to start getting involved with outdoor activities when they don't have quote unquote outdoorsy friends or family around them?
Paris again. My answer would definitely be dependent on where you live. If you live in the Puget Sound area, there are almost every city and both counties have specialized recreation programs that are totally worth getting involved in. The community is always looking for people to join. Oftentimes, you have people involved in multiple cities. So we have participants that go to Kent and Federal Way and Enumclaw and Seattle and Renton for their specialized programs, because every coordinator is a little bit different. Everyone offers different things, and through that you can keep your schedule pretty full. If you live outside of that area, I definitely think it's worth looking into your municipal parks and rec to see if they have specialized recreation programming or even anything labeled as inclusive, which might not be specifically for the disability community, but an avenue for you to get involved in recreation. I think it's also super important to remember you have the right to request accommodations. There are so many accommodations that are considered reasonable that people are scared to ask for or might think are not considered reasonable. You have the right to a sign language interpreter. You can request that at any government entity. You have the right to one-on-one support if you need it. It's definitely worth looking into what accommodations you can request if you are in an area that might have less specialized offerings.
Hi, this is Molly, and just a quick personal note for how to get started. Start small. Find something that you would like to do, even just going for a walk or just being out, just going and sitting outdoors. Start small, and then you might be surprised at maybe a connection you would make to maybe just go for walks or go to the park, what that might lead to.
This is Sarah again. Thank you both for your responses. I think the they're so right in just starting small, finding out what you're interested in. And I think, finding community will follow after. The more passion you can bring, the better. So we'll move on to what's looking like one of our final questions, which is from Cynthia. Is there any funding that can assist and pay for people to participate in outdoor activities?
Hi, Paris again. If you are receiving services through the DDA offers something called respite funds. I believe the requirements are that you have a caregiver or a minor with disabilities who is seeking, or I guess the caregiver would be seeking respite. So you can use those respite hours to fund recreational fee or activities. So any recreational fee we have associated with our activities, and I believe that would be the same with all government entities that offer accessible services, you can use DDA respite funds to cover those. Outside of DDA funds, most parks and recreation programs and non-government entities that offer outdoor recreation offer scholarship programs. I would say the same thing that I say about requesting accommodations, in that you just need to look and ask. People want to engage you. We want to get you outdoors. We don't want cost to be a barrier. Scholarships are often available, and more often than not, at least at Auburn, we're willing to work with you to get you outdoors.
Hi, this is Molly. She's absolutely right. You just got to ask. For our organization, we fundraise all year round to provide scholarships for campers, and we are just waiting for them to just ask us. It's, such an important thing to provide. We actually subsidize our entire camp, but then we put up a fee schedule, but the majority, over 50% of our campers, get a full ride scholarship. So we have specific donors that actually just donate for scholarships. I know there's more organizations out there like ours that are maybe specific to your disability. Seek those folks out and just start talking to them.
Wonderful. Well, I'll give us a moment if we have any last thoughts, reflections we want to share. If not, we'll move on to the end, I guess.
Sarah, I have a question for you. I think that you have some great experience with the outdoors, with camp and our family. I was wondering if you could just share, how important it's been to your life.
Sure. All right. Put me on the spot. Yeah, I think the outdoors means a lot of different things for different people. And I think the communities you form as a result of that can be really impactful and meaningful. I think as someone who's attended this camp and has spent a lot of time outdoors, one of the most important things is sometimes not even thinking of it in terms of disability, but rather just as like my ability to do what I want when I want it. I think through the lens of disability, that means oftentimes you have to plan quite a lot in advance and you're spending that extra effort. I think as many people with disabilities know, there's just not quite the same level of foresight for specific conditions when you think about the outdoors and when you think about accessing the outdoors. There's a lot of preconceptions about the right way to do it. But for me, in being able to have what I need so I can do what I want, which is a very basic way of saying I like being outdoors and I like having plans in place so I can enjoy them to the full extent. So yeah. Unless we don't have anything else, I will transition us. Okay, so thank you to all our wonderful panelists for their insights and reflections and expertise. We so appreciate you all taking the time today to talk about disability and the outdoors. Before we wrap up, would really appreciate your feedback. So if you are able to, we ask that you please complete a short post-webinar survey, either using the QR screen or the code I am going to try to send in the chat. My computer unfreezes. It should take less than 5 minutes to complete. And then another quick reminder that today's session was recorded and will be uploaded to the Disability Empowerment Center's YouTube channel. So if you'd like to revisit the conversation or share it with others, you'll be able to access it there. We will post that in about a week or so. And then we also hope you'll join us next month for our next Understanding Ableism webinar on August 18th, where we'll be discussing disability representation in popular media to understand how misconceptions and biases can unconsciously influence how we perceived disabled experiences. So thank you all for being a part of this conversation, and have a wonderful rest of your day.